family nurse practitioner student for Brenau University, and today I'm going to be doing a head-to-toe assessment on my patient Chelsea. Before Chelsea came into the room for her assessment, we gathered up some past medical history, family history, social history, and some vital signs. We got a temperature, respiration rate, heart rate, blood pressure, and her weight and height. Hey Chelsea, I'm Amanda. I'm the nurse practitioner student today that's going to be doing your assessment.
Okay.
So first we're going to start out with a head, eyes, ears, nose, and throat. So I'm going to look at her scalp, and I'm going to look at the color of the hair, distribution of the hair. I'm going to palpate the scalp. I'm going to check for any knots. I'm going to look for lesions. Any moles maybe. See if I can feel any moles. Okay, and then I'm going to go to her skin. I'm going to check the symmetry. I'm going to check characteristic of the skin and the color. And then I'm going to look at her eyes. I'm going to check her eyebrows, her eyelashes. I'm going to look at her sclera. I'm going to look at the iris. I'm going to look at the conjunctiva. Look for any redness or inflammation. And then I'm going to look at her pupil reflex with the light. I'm going to look for constriction. I see it there. See it there. Okay. And then I'm going to take a look at the retina. I'm going to look at the optical disc. And I'm going to look at the vascularity of the eye on each eye. Okay. And then I'm going to take a look at, I'm going to go ahead while I'm here and I'm going to percuss her sinuses. Good. I'm going to feel the facial bones. Palpate those. Everything is good and symmetrical. And now I'm going to look at her ears. I'm going to look for symmetry. I'm going to make sure there's no bleeding. I'm going to look on each ear and I'm going to palpate the auricle. Okay. And then I'm going to take a look inside at the tympanic membrane in the ear canal. And I see a pearly white gray membrane. I see a light reflex on there. There we go. And this one as well. Same thing in that ear as well. And now I'm going to look at her nose. I'm going to make sure the septum is straight. I'm going to check her nostrils for patency. Blow for me through that one. They are both patent. I'm going to check the membrane of the nose, and it is moist. Now I'm going to look at her mouth. I'm going to check the lips for symmetry. I'm going to check the color. Close for me. Okay, I'm going to check the teeth. Very good, very good. All right, and open your mouth for me. I'm going to look at the tongue. Lift your tongue up for me. I'm going to look at the bottom. I'm going to look at the palate up top. Okay, it's good. Okay, you can put that down for me. I'm going to look at, open your mouth for me. I'm going to look at the ovula. Stick your tongue out for me. There you go. And the tonsils. Very good. And then I'm going to check the gag reflex with a tongue depressor. Next, I'm going to ask Chelsea if she will squint her eyes for me real tight. There you go. And kind of lift your eyebrows up for me. Good job. Okay, and then I'm going to ask you to smile. Okay, stick out your tongue for me. Good job. And then puff your cheeks out for me. Good. And that is testing cranial nerves 5 and 7. Next, what I want to do is test her sensation. So I'm going to ask Chelsea, can you feel this?
Yes.
Does it feel the same here?
Yes.
Can you feel this?
Mm-hmm.
And does it feel the same?
Yes.
Okay. And then I'm going to move on down to the neck. I'm going to look at the neck here. Put your hair out of the way, sweetie. And I'm going to look at her jugular veins to see if they're distended, and there's no jugular vein distension on either side. I'm going to check the carotid pulse and check that carotid pulse one at a time. I'm going to look for symmetry of the trachea to make sure it is midline. I'm going to palpate the trachea and also the thyroid gland. Make sure there's no goiter. Look for a goiter. I'm also going to palpate the lymph nodes for swelling. There's no swelling noted. And then I'm going to test her strength of her neck. And Chelsea, whenever I put my hand right here, I want you to push against my hand. There you go. Good job. Same thing on this side. If I push, I want you to resist. There you go. Good job. Okay. So I'm also, while I'm here, I'm going to get Chelsea to look at the Snellen chart for me to test her visual acuity. And Chelsea, what is the smallest line that you can read?
DEFPOTEC.
Wow, all right. You have 20/20 vision. Okay. And the next thing I'm going to do is I'm going to listen to Chelsea's carotid arteries. So I'm checking for bruise. I'm going to do it one at a time with the bell of the stethoscope. Okay, it might be a little cold here. No bruise are noted. Okay, next we're going to move to the upper extremities, the chest and lungs. So I'm going to ask Chelsea, let me see your arms please, sweetie. I'm going to do the upper extremities. I'm going to look at the color of her skin. I'm going to look at her nails. I'm going to feel the temperature of her skin. She's warm. She's pink. I'm going to ask Chelsea, I'm going to look at the muscles up here. I'm going to look up here. And I'm going to ask Chelsea to put your hands on top of mine. And I want you to resist. I'm going to test the muscle strength. When I push up, resist my arms. Okay. And that's good. And then turn your arms around. And I'm going to come down and you resist. That's very good. Okay. I'm going to ask you to put your hands like this. And I'm going to try to push them in. Don't let me. Good job. And then I'm going to try to push them out. Don't let me. Good job. Okay. And then I'm also going to check radial pulses. 2+ and 2+. Very good. Okay, now I'm going to move to the posterior lung sounds. And yeah, you turn around for me, please. So I'm going to look at Chelsea's back. I'm going to look at her spine. I'm going to look for any kind of abnormalities on the back. I don't feel or see any. Okay, now I'm going to listen to her lung sounds. Okay, take a deep breath for me. Take a deep breath for me. Again. 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 One last time. And good job. Okay, you can turn around for me. And then I'm going to go and do the same thing here on the front part of the chest. I'm going to check her breathing. I'm going to make sure it's symmetrical. She's not having any labored breathing. I'm going to listen to her breath sounds. Okay. Breathe in. Good job. I'm going to listen to her heart sounds. Also going to palpate for any tactile fremitus, popcorn sound. I don't hear any. Palpate. Okay. All right, and so the next thing I'm going to do is I'm going to check right here. Hold on. I'm going to palpate her axillary lymph nodes. No swelling. Sorry. Okay, next, while my patient's laying down, I'm going to check her neurological function. I'm going to ask her to hold your arms out all the way and keep them there till I count to 5. 1, 2. You can let them down. There's no drift on each side of the arm. I'm going to ask her if she can feel this, and I'm going to ask her if it feels sharp. Close your eyes, please. Or is it dull? Dull. Okay. Sharp or dull? Dull. Okay. What about that? Dull. Okay. And here on the arms, same thing. Is this, feel that?
Yes.
Is it sharp or dull?
Dull.
You feel that?
Yes.
Is it sharp or dull?
Dull.
Okay. I'm also going to ask you, whenever I touch your arm, please tell me which arm I'm touching, okay?
Right. Left.
Very good. Okay. You can open your eyes now, Chelsea, and I'm going to ask you to, with your right hand or left hand, touch your nose and touch my finger. Nose to finger. Again, nose to finger. Again, nose to finger. Good. Now take your other hand and do the same thing. Your nose to my finger, your nose to my finger, your nose to my finger. Good job. All right, so then I want you to take your heel and place it down your shin right here on the top and just rub it down. Good job. Okay, and with the other leg, I want you to do same thing. Heel down the shin. Good job. Okay, and please lift this leg for me for 5 seconds. Hold it there. 1, 2, 3, 4, 5. And with the other leg, same thing. Hold it for 5 seconds. 1, 2, 3, 4, 5. Okay, and now I'm going to actually go to the heart, and I'm going to feel for pulsations of the pericardium. Any thrills? Don't feel for any pulsation there. And I'm going to ask you to lie on your left side. I'm going to come around. And I'm going to listen to the apex. Very good. Okay. Bring your back, please. Now I'm going to check the abdomen. I'm going to auscultate all 4 sounds in all quadrants, right, upper, left, upper, right, lower. Okay. And vowel sounds are present in all 4 quadrants. Okay, and then I'm going to look at the abdomen. I'm going to check for symmetry. I'm also going to palpate for any masses, palpate the kidneys. You have any pain when I'm pushing? Mm-hmm. Okay. I also want to look at and see, make sure I can't see the spleen, and I also want to palpate the liver. And then I want to palpate the spleen. Good job. And then I'm going to come down to the inguinal area, and I'm going to palpate for pulses, and I'm going to assess the inguinal nodes. And there are none present. Make Chelsea stand up. I'm actually going to check her lower extremity. I'm going to check her reflexes. And good job. All right. And then I'm going to assess her feet, her toenails. I'm going to check for pulses. And they're present, 2+. Present in this foot, 2+. Okay. All right, Chelsea, I want you to try to pull your feet up while I push down. Good job. And then with your feet out, I'm going to do this. I want you to push out with your toes.
Okay.
Like against my hands, push. Good job. Okay, down. All right. Okay, and then next I'm going to have you stand up, Chelsea. And I'm going to have you turn around, and I'm going to have you bend over, and I'm going to check her spine. I'm going to make sure her spine is straight. I'm looking for curves. There's no curves. The spine is straight. I'm going to palpate. Do you feel any pain?
Mm-hmm. No.
Okay. All right, good job. Okay. Now I'm going to ask Chelsea if she will just go stand over here, please. And I want you to face me, and I want you to put your arms out and close your eyes. We're going to perform a Romberg's test for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, Chelsea, I want you to walk with one foot in front of the other towards the camera. Okay, good job. Okay, you can come back over here to the door. Okay, so we tested her balance, and it was good. It was within normal limits. Her gait is within normal limits. So the next thing that we are going to do is get her legs, and I'm going to check for viscosities of her legs. I would, if her pants were down. Okay. Then after I have finished my review of systems, I would go and write down my pertinent positives and pertinent negatives and my objective data, and that's all.